My name is Kat Arndt, and I lead the client growth team here at Cedar. Cedar is a consumer engagement platform focused on improving the patient financial experience in healthcare. We're a team of roughly 130 people, headquartered in New York City, although everywhere nowadays. We use personalization technology, data science, and design to provide an experience in line with consumers' expectations across other industries. Here at Cedar, we believe that by improving the billing experience, we improve patient engagement, which ultimately leads to improved financials for our clients who range from provider groups to health systems. Today, I have the pleasure of sharing the screen with Dr. Janice Nevin, who is President and CEO of ChristianaCare Health System. We'll be discussing ChristianaCare's early focus on enabling radical convenience for patients and how digital health initiatives have helped to serve more patients during the COVID-19 outbreak. We'll also get our take on the healthcare industry's financial recovery and our hope for how technology will enable her vision of radical convenience going forward. Feel free to post additional questions you would like to ask Dr. Nevin in the Q&A section, and we'll be sure to get to them if time permits. I'm pleased today to welcome Dr. Janice Nevin. Dr. Nevin is nationally recognized for innovation in patient and family-centered care and population health, as well as her assertion that truly great healthcare is built on the values of love and excellence. Dr. Nevin is pioneering value-based care, leading a transformation from a healthcare system to a system that truly impacts health. Her awards and accomplishments go on for days. Headquartered in Wilmington, Delaware, ChristianaCare is one of the country's most dynamic healthcare organizations, centered on improving health outcomes, making high-quality care more accessible, centered on and lowering healthcare costs. ChristianaCare's accolades include 4 consecutive years of Best Hospital recognition by U.S. News and World Report, and Healthgrades America's 100 Best Hospitals, and 4 consecutive years as a most wired health system from the College of Healthcare Information Management Executives. ChristianaCare has been named by Forbes as one of the top employers in the US and by IDG Computer World as one of the nation's best places to work in IT. ChristianaCare includes an extensive network of outpatient services, home healthcare, urgent care, 3 hospitals in Delaware and Maryland, a level 1 trauma center, a level 3 neonatal intensive care unit, a comprehensive stroke center, and regional centers of excellence in heart and vascular health, cancer care, and women's health. It also includes the pioneering Gene Editing Institute and the unique Care VO program, which uses data and predictive analytics to create a high-tech for high-touch approach to virtual care management. Janice, thank you so much for taking the time to share your insights with us today.
Absolutely.
So let's get started. Would love to dive into your career and background. You've achieved so much and have been so influential in the industry. Can you walk us through your background and what you were doing prior to ChristianaCare that ultimately led you there?
Thank you, Kat. It's great to be here with you, to see you, and to be with everyone who's participating this afternoon. I'm a family physician. I also have a master's of public health, and I think both of those choices really reflect my commitment to health in a very holistic way. In fact, I wrote my medical school admissions essay on the biopsychosocial model of care. And so it's always been very important to me to think about how we create systems around a person so that they can achieve health and wellness and live a long life. And I started my career in academics. I did a medical school residency and I was on the faculty at Jefferson. I'm still a professor at Jefferson, and always imagined a career in academic medicine. And then one day in 2002, I got a call out of the blue to come and interview at ChristianaCare to be the chair of family medicine. And my arm got twisted a bit, frankly, to go an interview, but I came home after spending the day there, and I said to my husband, you need to know if I get offered this job, I am taking this job. I had never been to an organization where every single person I spoke to talked about the mission and how the mission guided the organization, how decisions were made based on the mission. And it was a mission that I could get into because it was really a mission of serving the community. And so I was thrilled when I got offered the job. It was an easy decision to make. I got to work immediately with wonderful people who were willing to roll up their sleeves and work together. And because Delaware is a small state and ChristianaCare has a large footprint in Delaware, there was also the opportunity to fairly immediately engage in health policy and public health initiatives that impacted the health of all Delawareans. I had the chance while I was here to move from academics into more of a physician executive role, and had some great experiences along the way, and have been the CEO for the last 5.5 years. And I will tell you, in all my time here, I've never once sort of gone to bed at night and been disappointed that we as an organization hadn't lived our mission. It really is who we are, and it's what we do.
Thank you so much. Yeah, having that mission is so critically important.
Yes.
Now, when you took on the leadership role of president and CEO, what were some of your top priorities and how has that vision evolved over the years?
Yes, so it's really interesting because I think the discussion that we were in when I became the CEO, in many ways has been the same discussion that's happened over the last 5 years, which is a general recognition that the way we were delivering care was not ideal. The way that care was being paid for didn't make sense. We were living in a fee-for-service world. And there was an opportunity for us to do better, a sense that the way things were was not sustainable. And so, when I started as the CEO, we continued to embrace the concept of value. And we've always defined value as those outcomes that matter to the patient, what makes their quality of life improve, and how do we do that respecting costs so that we can create affordability. We realized, I think, that in order for us to be able to help people get the outcomes they deserved, care increasingly had to happen outside the four walls of the facilities, where we were spending most of our time and energy. So over the last several years, we've really evolved from being what I think we have always been, a great hospital system. We've become a great health system. But as we think about the future, it's how do we become a system that impacts the health of all the people who live in all the communities that we serve. And that really is a commitment to population health. It's not only caring for the people who come to you and identify as patients, it's understanding that the community in which they live is very much part of how they achieve their health outcomes. And we need to be able to evolve to deliver that kind of impact, to deliver health. And we've defined population health as accepting risk and responsibility for health outcomes and the cost of care. And so over the last couple of years in particular, we've been executing on that strategy. We have invested deeply in primary care. We've in fact grown our primary care population by 60%. That's 60%.
Wow.
And it's not only sort of adding providers and adding locations. I think more importantly, it has been sort of rethinking how we deliver care, reimagining and then designing a new care model. And we have done that. And some examples of that, we have a virtual first patient-centered medical home for our employees. The typical patient-centered medical home starts with a provider in a facility and wraps the virtual piece around it. This is a virtual first strategy. So the practice is virtual first, and then if you need to go to a facility, you're directed there for a very specific test or reason. We've also invested in behavioral health. We have an entity called the Center for Hope and Healing, again, sort of flipping that patient-centered medical home model upside down, where the behavioral health diagnosis is really central, and then all of the other services that are needed get wrapped around the mental health needs of the patient. For several years now, we've done Independence at Home. It's a program for the frailest of the frail elderly. We've demonstrated we can improve outcomes, and we've reduced costs by 37%, which is just an astounding number. And we've also started to really rethink how we invest in the community. We're a nonprofit, so, obviously have some responsibility to the community, but we know that we need to use those resources to have impact and to improve health. So we've established a relationship with Unite Us, which is, again, using technology to actually identify and connect our patients to social care needs and resources. So just some examples of the way that we really started to think differently about, how we deliver care. I mentioned our mission, and I think that it's always grounded us. We've been around for 130 years, and all of the work that we're doing that feels new is still very much about the mission. But there's been a lot of change in the last 5 years. And one of the things that I wanted to do sort of midway through my tenure was to really revisit and redefine our values and the behaviors that support those values. I know that organizations not only survive, but thrive in times of great uncertainty when the people in those organizations are resilient and they're deeply connected to their values. And so we spent an entire year, I said to the leadership team, we're going to do this work together. And when I say together, I mean together. I said, I want to walk around at the end of this year, talk to anyone at ChristianaCare. They will tell me how they were involved in defining our values. And we did that. It was very much sort of ground up, leadership guided, but very much ground up. And what emerged was our value statement. We serve together, guided by love and excellence. And we serve together really wasn't a surprise because we love teamwork. Who doesn't love being on a great team, right? But we knew that we needed all of the teams in the organization to work together. And so we serve together was a manifestation of that. Excellence is in our DNA. It's just who we are. It's about being exceptional today and even better tomorrow. So there was no surprise about excellence. But when the word love emerged, that was a surprise. And it shouldn't have been, but it was. And it was a little bit controversial initially. We had a lot of really good discussion about what love means in healthcare. And I think what we have learned, particularly as we've lived with these values, is that love requires that you make really hard decisions. It sort of leads you to the hard work. And when you lead with love in healthcare, excellence is inevitable. So one of the things I am most grateful for as we have sort of been managing COVID-19 over the last, 2 to 3 months has been, this deep commitment to our mission, but this newer expression of our values and the behaviors that support them, because they've really been instrumental in the work that we've done over the last few months.
Wow, I really love that. Speaking of COVID-19, obviously, this pandemic that we're experiencing right now, which of course is top of mind for everyone. So wanted to dig into this topic a bit. I imagine it has to be one of your most significant leadership challenges. Can you talk about the ways that COVID-19 has impacted ChristianaCare?
So you're absolutely right. Maybe the most significant, if not one of the top. So I think, again, the good news is that, we had so much in place foundationally, so that like every other hospital and health system in the country, we were able to transform very quickly to become that public health infrastructure for our community. I think the other piece was that as soon as we started to see what was happening in Wuhan, we started planning. We didn't wait for COVID-19 to appear in our community. We started to do the planning. So, we had surge capacity plans. We brought those out. We started to think about PPE differently. We did rapid learning around testing. So the first case of COVID-19 in Delaware was announced March the 11th. And we already had our incident command structure in place. And as you can imagine, as soon as people knew that COVID-19 was here, there was a certain sort of element of fear and worry in the community. And we started to see that, people coming to our facilities in our emergency room. So literally the next day on March the 12th, at that 4 p.m. incident command meeting, we decided to do the region's first drive-through testing event. And within 14 hours, set up a mass testing event, found a location in the city of Wilmington that was easily accessible, which meant working with all kinds of people, including the police, to manage the traffic. It was, getting the people there that we needed, the coordination, the process, the flow, the tests themselves, all of the things that you need to register folks. And within 3 hours, we had tested over 550 people. And what was really interesting, number one, we demonstrated community spread. And that was really important because it then became the platform for a lot of other decisions that got made in the state, relatively quickly. I think we also were able to use it as a platform to message the community. What do you do if you don't feel well, if you're worried you have COVID? So that was really impactful. But we also demonstrated to ourselves, we can do things well and we can do them really quickly. And it was sort of another sort of emergency preparedness exercise. If we ever had to do mass vaccination, for example, we know that we can get it done and we can get it done really, really quickly. So just an example of the amazing, response from the organization. And that was just sort of, one example of so many. I mean, I think certainly for me, a lot of this has just been nothing but inspiration. Our caregivers are extraordinary. Every single person in every corner of the organization was impacted. They were asked to work differently, take on a different role, work in a different place. And even if they were doing the same role, it was in a very different context. And they really rose to the occasion. And, in this sort of world of change and uncertainty, what I saw was the power of those values of serving together with love and excellence. And the anxiety was real. I spent most of the first sort of 4 to 6 weeks coming in every day and visiting a different part of the organization and talking to our caregivers, talking to caregivers who are here and also caregivers who were working remotely. And, the work was hard. I don't want to minimize that. And I certainly don't want to minimize the anxiety that people were experiencing. And lots of worry really about their families and their community, as well as their patients. But as the days went on, the phrase that I kept hearing over and over again, this is healthcare, it's what we do. Mm-hmm. And that's very simple, but it is. This is healthcare and it's what we do. And again, it comes back to that mission. It's about caring for our community. It's about caring for each other. And we were able to do that in extraordinary ways. I think certainly our priority from the very beginning was the safety and well-being of our caregivers, and we made investments there. We had an unbelievable response from the community. So all of those relationships that we had in place were amazing. We have had so much PPE donated, 10,000 meals. This week, 2 Girl Scout troops delivered 6,000 Girl Scout cookies. So imagine that scene. And then just so many other expressions of gratitude. First responders driving by, the Blue Angels and the Thunderbirds driving, flying across our institutions. And so it's been it really just, that sort of sense of gratitude and appreciation. I know I feel it very, very deeply, and it's certainly felt by our caregivers. I think we also demonstrated we can work with others. Partnerships are important, but we really had to work across the state with others, including state government, in order to make this work. And we're still in it. We had the experience of sort of bending the curve, and we got to a plateau, and we stayed at that plateau for a number of weeks. It's really just this week that we feel, confident saying that the hospitalizations are trending down. And as such, like every other place in the country, it's a significant impact financially, and we're sort of digging into that. What will it be? What does it mean? And how do we respond to that over the next 6 to 12 months? I will say, one of the things that is also inspiring for me is, as we were so focused on COVID, we were still taking care of people who were really sick, people who needed trauma care, emergency surgery, cancer care. We delivered almost 1,000 babies over the last couple months. And we also opened up a brand new facility, a 400,000 square foot women's and children's building, with a whole new and innovative approach to caring for really sick infants. So, I think for me, again, just a great example of what our caregivers are capable of, and our understanding, our deep understanding that we need to serve the needs of all of the people who live in all the communities.
That is incredibly inspiring. Certainly your organization has risen to the occasion, and it sounds like being very mission focused and your value statement has certainly helped. It's interesting hearing you talk about hours and days of getting things done, because as we know, typically in healthcare, things move very slowly. And so it's certainly been, a silver lining of how quickly we can respond.
Absolutely, yeah.
What about this pandemic has been the hardest, or perhaps the most disappointing aspect for you?
Yeah, I think, one of the challenges has been around the communication. It's been really hard for people to find a place of truth. We understood right away that communication was going to be critical. And, we made a commitment to being transparent about what was happening inside our organization. We used every communication channel that we have, including some that we haven't actually used in a robust way before, like virtual town halls and regularly recorded messages. But it was really confusing for people, because they would come and sort of hear what we were doing, and then go home, listen to a neighbor, turn on the news, and wonder what to do with that information. And so, that was certainly one of the challenges. I mean, our commitment, again, was really, we're going to be transparent. We're going to tell you the truth. That one of our behavior statements was we speak the truth with courage and empathy. And we talked about that quite a bit, as we did this work. We're not going to hide things from you. And I think that was really important. We also made a commitment that the decisions that we were making were based on evidence. It was going to be about the CDC, the World Health Organization. And I think the other thing that was hard for people, because clearly we don't, as much as we know about COVID-19, there's a lot that we don't know about COVID-19. And the speed of learning about COVID-19, normally things in healthcare, something gets published in the New England Journal, and then 10 years later, it might be standard of care. And here, sometimes the evidence on Monday would be, sort of one set of guidelines, and by Wednesday, those guidelines had changed. And that's really hard. I mean, again, that's sort of that living in that world of uncertainty can be really challenging for people. And again, those values and behavior statements really supported that. I think one of the days that I was rounding, I spoke to a nurse, and she expressed it beautifully. She said, "I feel like I'm starring in a movie where I have to write the script, film the movie, and I'm doing it while locked in a movie theater. And I just thought that really captured, I think the experience of all of this for many people.
Yeah. Wow. Has the pandemic highlighted areas that you think will now really force a step change in the industry?
Absolutely. I think first of all, there's healthcare is complex, and I think, all of the conversation around disruption before COVID-19 was retail and, this app will solve this problem and that app will solve another problem. But I think we've created a collective understanding of the complexity of healthcare and sort of the depth of expertise that is needed. And frankly, every single hospital and health system in this country said, mission driven. No one said, should we do this? Everyone just rolled up their sleeves and became the public health infrastructure for that community. So I think we need to continue to appreciate the value that hospitals and health systems bring, and make sure that we value that. I mean, obviously, the virtual piece of this has been phenomenal. Again, we were in, I think, a pretty good spot where we were already making investments in virtual care. We had, our mantra was everything that can be digital will be digital. Everything that can be done in the home will be done in the home. We were thinking that was a 2 to 3 year strategy. It happened in 2 to 3 weeks.
Wow.
And I think it's been phenomenal. And so, Randy Gaborio, who's our Chief Digital Officer and CIO, says we now need a digital return to the business. And so I think we've got an incredible opportunity to take all of that learning, what worked and what didn't,
Yep.
And really pull that through. And I think what's been really also, for me, this pandemic has shined a light on the disparities that we knew existed in communities, but COVID-19 has really sort of accentuated those disparities in a way that we can't ignore. Communities of color, twice as many positive cases or more, twice as many deaths. And so we've got to deeply understand what drives those disparities. And I think not only as a health system, but really as a community, as a society, commit to taking action that will impact those disparities. We've had health equity as a goal, a strategic aim at ChristianaCare for a number of years. And so, from the very beginning of the pandemic, we understood that we would see these disparities. And some of the work that, I think I'm most proud of and is most moving has been the work that we have done around vulnerable neighbors. Whether it's vulnerable neighbors who live in skilled nursing facilities or who live in communities where there are serious challenges around the socioeconomics, around food security. And so again, innovation, technology, we were able to stand up some care pavilions, one at the Latin American Community Center and another at Kingswood, which is part of a purpose-built community in which we made community impact investment, and made it not just about COVID-19 and testing, but made it about how do we connect people to care. And so we as a health system need to take those learnings and understand how we can do more and have a bigger impact. But I think it's really a wake-up call for all of our community, really for the whole country.
Yeah, no, absolutely. You spoke around your philosophies and the idea of, obviously putting the patients first, and believe you've referred to this as the focus on radical convenience.
Yeah.
Can you describe a little bit more about what this means and other initiatives that you've done to achieve this idea?
Sure. So I'll start by saying that we don't yet have a system that is radically convenient. It's aspirational, and we fully intend to get there. But it really is, how do we deeply personalize the experience of health and access to care? You know, really being person-centric, respecting culture, language, and all of that, and really create a very sort of person-focused, health-focused delivery system. And again, that's why I think, you know, so much learning from what we've experienced the last couple of months around digital care, for example. You know, our virtual visits have increased to 650,000%. I mean, some astronomical number. We had one practice when we started. We now have 170. And I think what's happened is the physicians have had an experience, and they now see the value in this, and patients have had the experience, and they see value in this. And as one of my colleagues said, now that the genie is out of the bottle, it's not going back in. And so I think, you know, all of these just sort of different pieces of learning we can use to really accelerate the work that we were doing, the plans that we had to go further and further so we can create that radical convenience. You know, one of the things that we know is a barrier to care is sort of the administrative burden that patients feel. You know, picking up the phone to make a phone call to get an appointment, and then everything that happens after that, the bureaucracy of before the visit and after the visit. And we are in the process of implementing CEDAR. And that's part of our strategy to create radical convenience. It's about how people experience care, but we also need solutions to how people experience sort of the administrative aspects of receiving care. And again, you know, CEDAR's a platform that will allow people to do a lot of what they do now in person or on the phone, on their smartphone, and from the comfort of their couch. And that's really, you know, what we're all about.
Yeah, it's amazing, you know, as other industries just get more and more innovative on convenience, you know, healthcare looks even more behind. So encouraging that that's what you're focusing on. Going back to virtual visits and telehealth, do you believe that there will continue to be high patient demand for this post-COVID? And, you know, do you think the incentives and reimbursement models will support that shift?
So I think we've got some work to do. As I said, I think now that folks have had this experience, they will want it, expect it. I mean, one of the stories that I heard was from one of our minimally invasive GYN surgeons. You know, and you think, what could a surgeon do with, you know, with a virtual visit? And she talked about, and she was a little bit skeptical about the whole thing, but she talked about sort of the difference in experience of talking to a woman in the comfort of her own home about some fairly sensitive issues, and the deeper connection that was formed virtually than what might have happened in the office. So I do think that, you know, I think this is one of the things that will be a change from this, is it will be more and more people will have had this experience, they will have liked this experience, and they will expect us to continue to deliver this experience. You know, I think the good news is that CMS and other insurers very quickly recognized that this was a key strategy to managing through COVID-19. And you know, we figured out how to get reimbursed for it, as did others. We've got to continue to sort of pull that through. We need to not go back and then start undoing again as we think about the future. And we're sort of in that next phase of sort of recovering and reimagining. The reimagining part's really important. And some of that has to be, what are those regulations that will allow us to use this incredibly powerful platform responsibly and in a way that improves care and takes cost out. I would certainly, again, we've been very committed at ChristianaCare to risk-based payment, and we're in some up and downside risk arrangements. I think, you know, virtual care is one of the most important ways that we can improve health and take cost out. I certainly would be disappointed if, you know, we evolve a fee-for-service virtual care system. I'd love to see, the sort of the payment also be reimagined so that we again are being rewarded for the outcomes that we're producing and less about the volume of care that we're delivering.
Yeah, no, absolutely. Do you think that there are things that will go away in the post-COVID world and become a thing of the past more quickly than they would have otherwise?
Well, as my initial response to that is I would love to get rid of waiting rooms and wait times and anything that has to do with waiting. I mean, that waiting is waste.
Mm-hmm.
And again, you look at what we can accomplish with technology. Let's commit to getting rid of waiting and waiting rooms. I mean, that would be phenomenal. I also think that, and I've sort of said this a little bit earlier, as we think about coming back, we've got to think, again, to me, it doesn't make any sense to sort of go back to where we were even 3 months ago and then say, okay, now let's start solving the problems we knew we had before COVID-19. I think we've got to reframe, how we work. I mean, as I shared initially, we demonstrated we could make decisions in hours and days as opposed to months and years.
Right.
The thought of having monthly meetings to do a project over the course of a year just doesn't do anything for me. We've got to sort of take that kind of learning too and rebuild in a way that solves some of the problems that we know we had. So, it's what we talked about, this digital first coming back. It's also, can we be highly efficient? Can we, again, eliminate waste in a way that drives value, makes people feel cared for, but also improves their health and makes care affordable.
Besides waiting rooms, which I completely agree with you on that, is there something else, in healthcare that you don't believe will exist 3 to 5 years from now?
Yeah, I think that's a great question. The challenge with healthcare, it's very complex and diverse. So, I could potentially answer it, maybe for, where we are, and that would, really be sort of eliminating the waste, particularly around waiting and delays in care. And it would be about having that radically convenient experience. But again, healthcare is incredibly complex, and there are over 5,000 hospitals in different communities that all have to sort of navigate their own needs. Again, core is that commitment to serving the community, but how they do it is going to really depend on that community and what that community needs.
Yeah, no, absolutely. Going back to the financial pain, can you talk about, the financial pain that the healthcare industry is now facing? I mean, it's estimated that the stimulus package is only going to cover such a small portion of the losses that hospitals are expected to face. And of course, patients are significantly impacted and will have less ability, to cover their costs of their care due to lost insurance, lost income, et cetera. How is ChristianaCare thinking about this issue and thinking about the recovery?
Yeah, I mean, this is a really challenging issue. And again, we're not alone in this. I mean, this is, again, national impact. I think the good news for us is we started from a place of strength. Lots of learning after 2008, 2009. So we're starting from a very, very different position. I would tell like every other place, we stopped doing the things that generate a significant amount of revenue for us. And we also invested in our caregivers. Caregiver safety was a #1 priority. And we did whatever we needed to do to care for our caregivers. So it was PPE, it was prepaid childcare, hotels for those that needed to isolate, disposable scrubs, when they needed disposable scrubs, premium pay for people who were working in COVID-19 units. So we had this, significant decrease in revenue and expenses, at least the same, if not higher than normal. So we have a gap. Very grateful for the funding that has come from the CARES Act that will cover about, maybe 2 to 3 weeks of our losses. So, we are looking at this in a very strategic way. We'll be digging deep as we get each month's results to understand what the drivers are. We're using predictive models to think about, the next 12 to 18 months. And we will serve together with love and excellence and make hard decisions. But we'll approach this work the way we always approach our work, which is, we are here to serve our community. Our caregivers are our a vital resource, our most important resource, and we will come together. And I think we will work through this. We have a hiring hold like so many other organizations, but we haven't had to lay people off. Our goal is to try to keep our caregivers whole when it comes to their take-home pay. They've been with us through all of this. I think that is something I feel very strongly about. I'm deeply grateful for what they have done. But we know we're going to have to make some hard decisions in order to sort of get back onto that sort of that level that we were before all of this. Budgeting will be quarterly, and for the next probably 12 to 18 months. So we're going to enter a period of sort of rapid learning and making decisions in a way that we, and again, I can't emphasize this, that this is a once in a lifetime opportunity in many ways to do something for the healthcare system because we have had this crisis. And so our commitment is to come back, we're thinking about today, tomorrow, and the future, and to make sure that the decisions that we're making today create that future that we want and we know people deserve.
I have all the confidence in your ability to do that based off the foundation that you have set. What would you like to see more of or less of, from the government? Like, what do you think has been working and what do you think has room for improvement?
Yeah. So obviously very grateful for the funding that we had received. I'd love to see more of that, and perhaps with, sort of fewer restrictions. Again, we didn't, at the beginning of all of this, we just rolled up our sleeves and did what was necessary to care for our community. And it would be great, if some of those expenses that we incurred were reimbursed by the government. We talked about the importance of continuing the payments for virtual health, and again, in a way that really supports the future that we're looking for. There were some regulatory changes that happened. Again, I think there needs to be a very careful review of what are those regulations that were put to the side, that we leave them to the side, and others that we think and others that were new as a result of this, that we want to continue. Our ability to work closely with private practice physicians is really important when you think about delivering value-based care. You mentioned earlier the unemployment. I mean, the numbers are staggering. And I don't think we have seen the full impact yet because, it's really been in many ways very early. And we know that there were employers who supported their employees' health insurance for a period of time. I think we're going to see that start to erode. And so the shift in payer mix is a real concern as we think about our future finances. So government intervention to help employers preserve healthcare insurance for their employees, I know their employees would really appreciate that, but fundamentally it will be helpful for the whole system. I think one of the things that is important to understand is, often health systems drive the economy for their community. And that's true for us in both Cecil County, Maryland, and in the state of Delaware. We're the largest private employer, and Delaware's economy is very much, and the success of that economy is very much intertwined in our success. And so there's an economic value that goes beyond the health system if the health systems get the investments that they need in order to stay strong.
Yeah, no, absolutely. Would you say that there's any initiatives or learnings from other countries that you think should be taken seriously here in the US?
So, I mean, again, the amount of learning that has already happened and will continue is astounding. And absolutely, we should learn from other countries. I think, again, because we were sort of in that mid-March wave of COVID-19, we not only looked to what happened in other countries, but what happened in Washington and what was happening in New York as we did our planning. And frankly, we benefited from their experience. I do think that we will see that countries where the culture is to have a strong national presence around public health, I think we'll learn from those countries. I think that's been some of our challenge. Frankly, there was a period of time, when where states were competing to buy PPE, or competing to get ventilators, and that's really hard. And just it didn't feel right. And if you're a small state without a lot of resources, you can't get into that. You're not going to be successful in that. So I think there'll be some learning about what are the right roles and responsibilities for every level of government. I certainly hope we'll do that learning. It's something that I would like to see.
Okay. Delaware's small, but certainly mighty.
Small but mighty, right.
Lastly, what advice do you have for healthcare administrators that might be listening today as they're battling, so many of the same challenges that you faced in the recent months on both the clinical and more operational perspectives?
Yeah, I mean, I think I go back to mission. I think, certainly for us, having that mission be front and center and understanding those values, understanding how important our caregivers are always. It's very grounding in terms of how you make decisions. I also think that it's really important to be intentional about thinking about the future. I think that we have been sort of spending so much time in sort of today and what needs to happen every day, and we needed to do that, and that's been really important. But I think we also have to think about tomorrow. How do we build for tomorrow? And then how do we make sure that we're creating that foundation for the future? And so really thinking about strategic planning in a very different way, really important. And that will require some courage, because again, we're in this sort of unusual time of being really stressed financially, but we've got this opportunity to reimagine, how we come back. And so I think, again, that mission, those values, engaging those caregivers and being bold and courageous about thinking about the future, really important. Again, a lot of our ability to manage these last 3 months has been because we had made decisions earlier. And those decisions, even though they weren't made about the pandemic, proved to be really instrumental in our ability to manage. I think for me, some of the greatest learning has been just about healthcare itself. I think, healthcare is complex. It's really challenging. It's inspiring. And although we've talked a lot about sort of digital and virtual and so forth, I mean, at its root, healthcare is about humanity and empathy, and I think we've learned the importance of that human touch. We take care of people, and we should never forget that.
Thank you. We have some submitted questions. Since we have a little bit of time, if it's okay, I'll read off some of them. One submitted is, what can providers do in the near and long-term future to reduce cost while maintaining high standards of care?
That is value. How do we deliver greater value? And I think it is, again, being very intentional, being very bold and courageous about eliminating waste. I can remember when I was being interviewed to be the CEO, being asked a question about sort of what do we need to do that. And I remember saying we need to build a layer of care in the community that doesn't currently exist. And it goes back to, how do we care for people with more complex needs, with more acute needs, in the home, in the community, in a less expensive setting, but in a way that really promotes health. And so, really thinking about, again, this is not a time to stop learning, to stop being innovative. This is a time to really embrace learning, embrace innovation. What are those tools that we have at our disposal now that we can use to solve some of these problems so we can eliminate waste, improve health, and reduce cost? It is going to be really hard work. We are not talking about projects, we're really talking about behavior change. And it's not just how health systems behave, it's how we all behave, what we expect. And that's why, this work that's happened around virtual care is so important. We know, and we knew this before COVID-19, people who experience telehealth, people who experience virtual care loved it and wanted to keep doing it. We just didn't have enough people who had that experience. Now we do. And so let's not lose this opportunity, because ultimately I think that's how we take a lot of waste out of the system and how we make the finances work. I mean, just a small example, we are, our EHR is Cerner. Going into COVID-19, we had about 30,000 people signed up for the portal. We now have well over 100,000.
Wow.
So there's an opportunity there that we have to recognize and hold on to, with goals of improving care and reducing cost in mind.
Great. Next question. What strategies do you use to engage with patients who have barriers to accessing technology needed for virtual care? So for example, patients who don't have a smartphone.
Yes, so we actually received some funding from the FCC. We got a $714,000 grant that was specifically around solving that barrier. This was some of the funding that is very much targeted to solve issues around COVID-19. And so that's how we will be using those dollars. It will be going to vulnerable communities throughout the state, actually providing devices where people don't have devices, that include sort of cellular data, so that they can not only have the device, but they can actually use the device. There's funding for broadband. And so, I think that we know that that's a barrier. I think this is one of the ways that we're thinking about solving it. I think we've been surprised. We have a Medicaid risk contract, and we've been, I think, pleasantly surprised at how many of those patients actually have smart devices and are willing to engage with them. We've also had some experience with our Independence at Home program deploying devices. It's another, if deploying an iPad it's got one app on it, and that app connects someone directly to one of our virtual caregivers. So it's helping people who have devices connect so that they can use their devices, and then where devices aren't available, supplying those devices. And then again, some of our learning is it's not just about supplying the device. What's it being used for? What's the training involved? And how do we continue to support people using that device?
Great. Congratulations on receiving that funding.
Thank you.
Another question. I love the idea of value-based care. Some other countries also use a subscription model where a provider would receive essentially a salary based on how many patients they are responsible for, rather than the services or diagnoses. Right. Essentially one step further than value-based care. Have you ever considered borrowing from this model?
Yeah, so I mean, that sort of the version, that's capitation. It's, I'm going to pay you per member per month amount to manage the care needs of a particular patient. And so there are places in this country where that model currently exists. Absolutely, I think for me that is the goal, because then it's sort of like you're prepaying the provider who can then work with the patient. How do I use the resources to make sure that you get what you need and you get the outcomes that you deserve? And we manage things in such a way that we don't, that we manage inside our budget, essentially. So that is, ChristianaCare. We've talked about that model, and we are, have actively sought partners that are willing to work with us to deliver that model of financing care.
Wonderful, thank you. Well, Janice, this has been incredibly insightful. Thank you so much for taking the time to speak with me today. And I wish you well, and I hope that you all keep fighting the good fight out there.
Thank you, Kat. It's been an enjoyable hour. I really appreciate it.
Thank you so much. Thanks everyone for tuning in. Be well.